Everybody, and welcome to another episode of the 19 Hills Community Health and Capital podcast. I am really excited to have with us Anne Marie Cunningham today. Anne Marie is on my embarrassment list of people that I've known since the COVID pandemic that I'm still yet to meet in person in the flesh, which is quite pathetic, I think, to be honest, really, isn't it? But hi, how are you, Anne Marie?
I'm very good, but I think have you not known me since before the COVID pandemic?
Well, it was about that time we were all
Was it
trying
by
to
that
kind of,
time?
come
Okay.
in and change things fast and work in
And
innovation and disrupt the systems. And we were going to build a new normal at some point, really, weren't we? And
yeah, I'm
things have
even
been strange.
surprised that we haven't met face to face. I didn't that hadn't registered with me.
The
So there
boundaries
we
blur,
go.
don't they? The boundaries blur. You kind of
The
it all kind of
boundaries
wraps into
blur.
one virtual world. You're coming into us today from across the water, I think,
I
aren't you?
am. So I worked for 20 years in Wales, and I continually had to kind of explain to people why whenever I met them I had a Northern Irish accent, and they were a little bit surprised at that. They expected me to be Welsh. Um, but I am from Northern Ireland. I am as back to my roots as I could be. I am living 150, I'm in a house 150 yards from where I grew up and where my mum still lives, and I've got my family around. I went to Belfast and studied medicine and trained as a GP, and then left after that to go to Bristol to do public health, to try that out, and did a 6-month SHO post. And then decided I didn't want to do public health, but went and worked in the university in Cardiff, did a master's in public health there, and worked in education and doing research for 13 years. Then left there to work in an Iron Bevan Health Board as a primary care clinical director, and then went from there to Digital Health and Care Wales, where I was Associate Medical Director for Primary Care. And during my 5.5 years there was the time of COVID. So I was very involved in a lot of the projects that we were doing there in relation to identifying shielding patients, vaccinations, identifying people for COVID treatments, and all the rest of the things that we put in for supporting primary care during COVID. So a massive amount of change. But through all that, my husband and I made the decision of moving back to Northern Ireland. So I've come back here. I work as a GP and as a GP medical advisor in the Department of Health here. So it's lovely to be back in Northern Ireland, but I really appreciate all the networks and people and friends that I made in Wales and the changes, and I keep a very close eye on what's going on and still stay very linked in with people over there. And I guess that's part of the reason that I'm going to be back in Cardiff again this weekend on the 1st and 2nd, running the NHS Hack Day again.
Absolutely. So that's the theme for today, talking about
Yeah.
this NHS Hack Day, which is going to be coming out literally a few days after this podcast goes live. So these have happened before, have they, Anne Marie?
Oh,
Tell us a bit more about them.
absolutely. This is number 28. So they've been going since 2013. Or 2012. I went along to the first one that I attended was in Oxford in 2013, and I think I'd already nearly decided I wanted to run one in Cardiff. At the time I worked in the university. I managed to get Professor James Morgan, an ophthalmologist, to be my co-organizer in Cardiff University, and we went for it and got the Hayden Ellis building, a brand new building at that stage, hadn't even opened, in the medical school, uh, and we just did it, and we had a great event. We've done, this is like number 8 since then. So we had a big one in 2020, and then a bit of a break through to 2023, and now back again. So we've got a really kind of refined formula that we know works, usually despite the size of the group or the makeup of the people. Amazing things happen when people come together with a commitment to try and make things better over a weekend. You get the best kind of people, and it's always a pleasure. So really looking forward to that, being back in Cardiff.
So I think Hack Days, some people listening will maybe be a little bit familiar with the format, I guess, really, but kind of just run us through what it involves and what opportunities people that come to these tend to get.
So I suppose one of the first things always is said, it's called a hackathon or a hack. And people think, is this about hacking and breaking into the NHS and security and things like that. And no, it's not. It's more like if you sort of said, and it's actually kind of coming back a bit on social media and TikToks and things. It's like, here's a hack. Here's a hack for how to do your shopping on it or how to make your lunch. And it kind of means an idea of like a fix or trying to come together to say, how can we fix things reasonably quickly or, build something or I'll make something that'll change this. And in this case, we work there have at this time about like 15 years ago, there was a change happening around the world, or particularly, I suppose, in Europe and in the US and generally, yeah, pretty globally, because the internet was kind of coming off an age. And there was a different approach then to how you actually went and developed tech products and sold tech products. And so out of that was this belief that you could kind of get together and probably throw something up and use this as a process and a way of figuring out and understanding the problem better. So Kim had that event coming out of this, and the format of the event is that on Saturday morning, people who have a problem, so they have a problem and they will say, this is my problem, and they'll get 1 minute to try and convince and explain other people that this is a problem that sounds interesting, or also maybe could have something that could be solved about it over the weekend. And it's a very, very wide range of things. We've had people that have wanted to build a tool that would help you organize how to do walks if you were walking the Wales Coastal Path and make a team and coordinate all that. We've had people that have said, I work in housing and I want a way of the residents to be able to connect with each other and have kind of more social interactions. We've had people coming that know a lot already about tech, and from a parent of somebody with type 1 diabetes who wanted to do work on how to get the data from blood sugar monitors out and into a platform where maybe clinicians could review that in advance of a consultation. We've staff who say, I want help trying to figure out how to run my clinic better, or I'm a junior doctor and I still am struggling with doing handover in our team and I want to solve something about that. So we have problems that come from all different perspectives. We also do have some people that say, I want to figure out how to use AI for this or something like that. And we try to say, do not be technology led. We should start with the problem, but we don't kind of like shout them down when they come up and start speaking. But we are very much saying start with the problem and then get together and work it out. And we've a real mixture of people at the event. So we've got people that come more from a tech background who are maybe developers. And of those people that come, usually about half of them already work within the health sector and half of them don't. It's amazing. So you've got people turning up. This time we'll have a wonderful woman who is doing a PhD in astrophysics, who heard about the last one in Cardiff, came along, had a great time, and has signed up to come back again. Will she ever end up working in health? Maybe, because she'll have had a chance to come along and see what these problems and the nature of things are like and how and have these interactions. And that's one of the real strengths I think about it is it's hard to get people to come and work in tech in the public sector. So if you give them a chance to come along in a very low risk, safe environment and play and meet people who actually have problems and understand the nature of those problems, then they might decide to go and apply for a job or start some kind of a startup in that kind of sector, or just stay involved and join our community. And then we've got a very wide range of people on the other side who are like health professionals or patients, carers, interested citizens, coming from all different sectors. Although it's called NHS Hack Day, we're not in any way officially affiliated with the NHS. This is very much a volunteer-run event. We don't use any NHS logos in there. Sometimes we've got sponsorship from the NHS, not on this occasion, but there is definitely participation from people that work in the NHS. And then we've got another group of people who work around the tech sector who are absolutely fantastic, who are people who know about, say, doing user research or service design, which are some of the tools that you use whenever you're trying to develop products. And they bring an awful lot to the event when they come along. And then you'll get people they'll work on something completely different. So we've had people that are data scientists end up doing a bit of project management for the 2 days that they're there and trying out that. So we've got, they come together, they do the pitches in the morning, and then we get everybody that's pitched to take a big piece of A1 or whatever size, a very large piece of flip chart paper, and write down what the problem is and stick it up onto a pin board and wait for people to come up and talk to them and understand what is their problem, what can they sort of do, and then they just go off and form a team. Now, some other hackathons and hacks over the years have run by virtually people think there's like a big prize and there might be investment. So you come along with your idea already and what you're going to work on, and then you're time limited. You don't change your teams, you don't do anything. You just come along and you work on that to try and get as far as you can on it so that then you go and you present it back the next day. And that's not what we're about. We're about people mixing and learning. If you work it, you could work on more than one project. You could start on one project, get up, leave, and go over somewhere else. We do shout outs on Saturday afternoon to let people sort of understand what it is that they're maybe missing from their team, what skills could they use with, does anybody know about this, and come and help them. The prizes that we have are very coveted NHS Hack Day t-shirts. So there is no big prizes at this event. We don't see any value really in trying to have something like that. In our experience, that people want to take things on, and sometimes they have taken them on, but if they want to take it on, then they will get together and they will make it happen. And there's a wide range of expertise at the event. They might have already met somebody that would help them with this. But often it is just that people come and they work on something and they learn and they're able to share back, they've developed themselves, and that's the outcome really that we're looking for, rather than saying that we're going to have ideas which are taken onto market and that this is like a hotbed in a way for innovation to be taken onto market. That's not what it's about.
Sure. Exciting. I mean, it's the power of networks, I guess, really, isn't it? And I know from what you were saying before, the interest in this event has been really high, which is really exciting
Yeah.
too. I just, I appreciate the format has changed over the years, and I suppose the world around us since 2013 has changed considerably. I know that it will be difficult to predict what outputs have been generated from events like these, because they'll be so rich and so many that you wouldn't be able to kind of keep track of them necessarily. But what are some of the things come to mind that you've seen grow from the hackathons onward?
So because we're volunteers, sometimes we're saying, oh, wish we could track back better and figure out where things actually went on and what happened. And sometimes it's by accident, we hear about what happened afterwards. So in 2018, I'd applied for a Fairer Tech event, a small grant, to be able to, it was for £500, to be able to make tech events more accessible to a wider range of people. And at that time, I knew of an organisation called Barrett who work with people with learning disabilities and enable them to participate in conferences and things like that. And I thought, I wonder, could we work with Barrett to bring some people with learning disability to participate in NHS Hack Day? And we did. We worked on that. We got a group from Carmarthenshire People First, who came down and were supported by Barrett to participate, to take part in the event. And they pitched that they would like, there is a paper kind of passport, which is used often with people with learning disability, that explains what your needs are. And when you go into hospital, you can show this so that your needs are understood. And they thought about how would it be if we actually did a digital version of this, what would be the issues, what would be the pros and cons, and they worked through all those elements over the weekend and kind of prototyped out what it would look like. And they had a great time. And one of the things for me was thinking, how do we if you can make an event more accessible for people that have got learning disabilities, like in general, whenever you start considering accessibility, if you make it more accessible, then that benefits everyone usually to make it just the same. That's a good thing for everybody. So it made us think about the language that we use and how we explain things. And the group afterwards, that was in 2018. Of course, and with COVID, nobody knew what was happening during COVID. We didn't run any events for 3 years. We had no interest personally in running virtual events. We were all spending our time working virtually, and we didn't want to try and spend our weekend at a virtual event as well. So I was back in contact over the last month or so, or few months since I actually launched this event, and heard from the team that they've actually taken it on. There is now an app that you can get where you can get that learning passport. And it was what they'd learned and done through our event and the time that they spent on it, which enabled them to take those steps on to actually bring that to being a real product. So I think that's the sort of thing that can happen. We've had a few different projects. We've got a few founders, people who've gone off and founded groups that definitely have come up through our NHS Hack Day kind of pipeline. We've had people that have came and left and changed their career because they came along. Um, and I think even like for me personally, I started this. I worked in Cardiff University in as a lecturer doing it. I was involved in use of technology in education. But through all the events and going along and meeting people and the networks that I was participating in, it gave me enough confidence that when a role came up for within Digital Health and Care Wales as the primary care lead, to think I could do this, I could understand and participate and take part in that. So it helped me change my career trajectory. It also for my husband, who worked in a different sector, and he was coming along then to these events with me. And when I was like saying to him, look, I went down to a meeting actually in DHCW, and I said, if you come, you should, if you're going to change sector, think about going there. It's very close to where we live. And he did apply. And again, he thought, well, I know some of the things because I've been along to this event and I know some of the people that are around there. I know the kind of issues and problems. And basically, he picked up on some of the, you know, ways of interoperability issues, etc. And he joined DHCW and he's still working for DHCW remotely now for the last few years. So I think it definitely does help to give people that little bit of a taste because I think there's the concept of like tech for good, and this is definitely about tech for good. And people, especially, younger people are very driven, values driven, and knowing and having that chance to really experience uh, uh, what people's problems are and how you might be able to contribute to them is very powerful.
And it goes to show you, just as I think you said at the early part of the podcast, didn't you, Emery, that this isn't always about money.
No.
That was £500 to start off with, really, and the power of the story that you just gave is huge, really. There's a huge interest, obviously, in tech and innovation, particularly when it comes to the health system, not just in the UK, but internationally. And, people talk about lots of barriers and lots of challenges. I just want Anne-Marie, obviously, in a devolved nation, such as Wales, such as Northern Ireland, um, there'll be, I suppose, some similar challenges to what other countries may face or across the border in England. But there may also be some kind of unique challenges, both in the public sector and the commercial sector. And I just wonder your thoughts around there of kind of, what could we do differently?
That's a good question. So, so generally, I suppose that one of the big debates and the discussions always, I mentioned interoperability there. I don't know what would you think I mean by interoperability?
I suppose
I'm going
how
to use you
well
as my
different systems speak to each other.
Yes, it's about being able to share information across systems. And sometimes you can technically connect it, but you also have to make sure that the information means the same thing. So this kind of idea of semantic interoperability, where the way you've labeled it and everything, you're actually talking about the same thing, even though you've just got the data going. So that's always been a challenge. How do you bring information together across different organizations, different groups of users, uh, for both the purposes of direct patient care and also for that you can use it in aggregate to be able to understand patterns, or at an individual level that you can spot changes and things happening as well. And there's a lot of talk, isn't there, about using AI for this now, being able to, like, as if sometimes it's talked about as if it's a little bit magic. There'll be something will come along and it'll solve all these problems. So with the interoperability challenge, in some ways, you've got some things have been solved a little bit by kind of aggregation around particular systems. So rather than in Northern Ireland, there's for secondary care, there's been a big procurement, a big program going on where all of secondary care, all of mental health, all of social care are going to start using the one product called Epic, which in secondary care has nearly rolled out. It's went out live in 3 trusts in just over 15 months, and the last 2 trusts will go live in 3 months' time. That's a very fast rollout. And that means that there's a lot of data potentially there altogether. There's been in Northern Ireland and Wales and in Scotland, going down to just one GP system. So you've got the GP data sort of still there all in one place, and you can start pulling this together. So that's like, is that better because you've got more and lesser systems and it makes it easier to do this interoperability? But in general, I would say you don't tend to have many economies of scale of like the small scale, because generally the same kind of level of assurances, etc., need to be done as if you were running a larger setup. But of course, England, or lovely big friendly neighbor, England doesn't have usually there's not many things that are single for England. You might have it down to the level of the ICB. You might have it down at a smaller stage. So all of their, in a way, having the same systems and aggregated data across over 3 million in Wales, or nearly 2 million in Northern Ireland. That's maybe about the size of like a lot of the organizations that are working there, maybe some smaller, some larger. So we're comparable in that size, and I think that's increasingly the scale that is being used in England, with some things being pulled together. There is the work on the federated data platform in England, which probably would need its own podcast, and it would be interesting to do if you're interested in that. But yeah, I think that we've got the other. Always people will say one of the strengths of the smaller countries are that we tend to know each other. People they're connected. It's more like a human scale for coming together. And I think that is maybe why in England as well, the ICBs are kind of coming into being similar sort of sizes of scale as well. So I don't know, has that answered your question well enough? What were you thinking of?
The relationship bit is really interesting, isn't it? Because you don't just need the assurance, the data flows. The people in each institution need to trust each other too, don't they? And
Yeah.
to be able to kind of know what the information is being used for. I mean, you hear examples in Estonia, I know, is one really where they digitalize the whole public sector. So, you have one unique reference number per citizen. All of their information goes onto one system. I'm not hugely familiar with it. But I suppose you also wonder, what interest is there on the commercial side for producing tech products for the likes of Northern Ireland, for the likes of Wales? Are we big enough for that market really? Is the UK still too lopsided in terms of kind of focus on all the exciting innovation happening close in and around London in the southeast?
I think that there are some interesting things in particular about Northern Ireland and about Wales. I mean, Northern Ireland is in a very particular position because of where we are in relation to Brexit in the EU and the Windsor Framework and regulation, where Northern Ireland might be the place if you were going to come and develop. You might come to Northern Ireland because you can cover off being ready for market to the UK and being ready for market to the EU. So that's pretty interesting and I think exciting to people. Wales has already done a really good job about pulling together data in Sale in Swansea University in the secure anonymized information linkage kind of system. I mean, that is a wonderfully data rich platform. Hard to really state how good and how early on and clever Ronan Lyons and the team were about getting things sort of set up in that environment of an enterprise kind of research platform, being able to, that's a model that's being considered and rolled out in other places, but you've already got that expertise around data and being able to research it, find things out. Years ago, a friend was doing an evaluation research study and it was happening in England, but they went to Sale to be able to pull that data together because of the expertise that was there and being able to make that happen. So I think that there's definitely some strengths that need to be played to and looked at when we're looking at these. And I think it would be foolish for anybody that was coming along and developing any kind of, data or AI strategies for the UK to not pick up on those strengths of the individual constituent countries. Scotland's also got its, strengths in that it's got quite kind of similar settled populations, but also quite big differences between, urban and rural, and you've got a lot of different range there. So I think there are strengths to all the areas for coming in, but I think it's I always feel that the main benefit for us um, from looking at health data still is in what we can actually save and do better internally for ourselves. We're working out where the better outcomes are, how we can work the whole use of data for value-based care, for being able to not see people unnecessarily, not bring people up back, uh, um, picking up on drugs and how we actually use them properly and identifying waste. If we can actually just do well there, we'll have got the value back for ourselves anyway. And if we're able to have demonstrated then what we can do and how the success we can have with that, that certainly could make it useful to other places. And some of the things that need to be worked through, they're the same everywhere. And I mean things like working through things about the security and how you're actually doing your data management, your governance. How do you have smaller suppliers working together? And if we can figure those out and become really expert in crossing and helping companies do that well within the UK, that can be really useful for other countries as well.
Brilliant. Well, we're going to put this podcast out a few days before the Hack Day. Tell us, Anne Marie, if people were interested to find out more and to perhaps register, where would they go to and how could they do it?
So go along. Our website's very easy to find, nhshackday.com. That's nhshackday.com. And on that, you will find information to sign up to the event. I usually have never actually stopped people from signing up for the event, even up to the last minute, because some people will drop out and other people will come along. Might have to this year because it's been really well subscribed. If you can't sign up to this event or you can't make it because this is pretty short notice, first of all, you might want to just come along to see the presentations on Sunday afternoon, and you can sign up on the website just for that. It lets us know that you're coming on Sunday afternoon just to see what's produced. You'll be astounded. It's wonderful. You can also sign up on the website for our mailing list to know about future events. We only use that website for that purpose. We don't give your data out to anybody else. We don't bombard you with information about other things. We will just tell you about the future events coming up. Even if you've attended this one, we won't automatically tell you about the next one unless you've signed up to the mailing list, because we really care about not messing around with people's data. So do that, come along, follow us along on Blue Sky. We are not using the other platform any longer. Follow us along on Blue Sky. We also manage usually to record our presentations and share those out, and you can find information about all the projects that have happened. There'll hopefully be blog posts written. We've got a wonderful photographer called Paul Clark coming along and doing us a great favor again and doing this, makes absolutely wonderful images, and you can use those to write blog posts and things as well. So yeah, come along and find out more about it.
Well, thank you, Anne Marie, and a huge well done for what is a huge industry of these events over a long period of time. We're really excited to hear what happens this weekend. And we look forward to getting you on a future podcast to talk more about data, innovation, and how we do it in the public sector and outside. So thank you, Anne Marie, and we
Brilliant.
look forward to speaking again soon.
Lovely to catch up. Thank you.